All right, third time's the charm. Sorry about that, guys. So Dr. Becerra had to update the app. Instagram is, I guess, doesn't allow you to join in live if you don't update the app. So hopefully she'll be joining us right now, and we'll get started on this interactive Q&A. Sorry about the delay here with the technical difficulties, but hey, it'll be worth the wait. So I'm just waiting for her to join, and then I'm going to go ahead and add her in and get started on this. Welcome, guys. Welcome. Hope you guys got your questions ready. I'm just waiting for Dr. Becerra to go ahead and join us so I can add her in, and we'll get started. There we go. Dr. Becerra, let me send you an invite. Perfect. Sending it to Dr. Becerra.
Yes.
Hey,
I
Dr.
think
Becerra.
so.
We got the issue squared away.
Hi, how are you?
Pretty good. How are you?
Fine, fine. Little bit difficult for me. So sorry for the update. How are you?
Oh, no worries. I mean, I didn't even know that Instagram does that, but I'm glad to have you here. There's been a ton of interest in your clinic ever since, you joined us, and people interested in your services, and I've heard nothing but good things about you from your patients. So I'm really excited to have you join here and talk about hair loss and hair transplants and your philosophy and your protocol and everything. Um, so I did get one question that someone brought up recently, and that was about your views on finasteride. There was, I guess, somebody had said that you told them not to take finasteride or something like that. And so some people believe that you're like against finasteride or something like that. But I just wanted you to kind of, what are your thoughts on medication and finasteride and all of that?
Okay, now I had a small video related with finasteride and minoxidil in my YouTube channel, but I want to give detailed information to you. Now,
Mm-hmm.
I'm not against or I don't support finasteride or minoxidil. As a doctor, I think that every patient has different cases, and we need to think and consider his hair loss and how active his hair loss, how many hairs he's losing per day, what is his age, and I consider a lot of factors while I'm how can I say suggesting finasteride or minoxidil, or while I don't suggest it. If
Mm-hmm.
the patient has very active hair loss, if his age is young, and sometimes I may suggest finasteride, but this is not my routine procedure. It means that I don't give all of my hair transplantation patients finasteride or minoxidil. Just I choose some of them. If they have active hair loss, generally I don't do hair transplantation. Before it, I send them to the dermatologist, or if they are in Turkey, if they stay in Turkey, I may give this kind of medicine for a limited time to take the hair loss under control, then a safety period, then the hair transplantation. But generally, I don't give all of my patients finasteride after their transplantation.
Okay. And so what are your reasons behind that? Like, why don't you? Is it just depends on the patient? If they don't want to take it, then, you don't force them. Is that what like your
No,
protocol is?
no, this is the reason that I consider these are medicine, and I think that I need to check the blood test because
Mm,
they have some side effects, and nobody can tell that use it and go and do whatever you want. This is not my strategy. If I have a patient, I want them to be under my control, and I want to check their blood test. I want to check their problems related with their health, and if if I have chance for this, yes, I may give some treatments to them. If I have
mm.
no chance, then I ask them to go a dermatologist in their country, and just take under control their hair loss, then continue according to it.
Okay. Yeah, so that makes sense. I think what you're saying basically is, since they're your patients, you want to make sure that they're blood work checks out before you start medicating them, which I think should be the proper protocol. And if they are in Turkey, if they're like a Turkish patient or something like that, and you do their blood tests and everything, and their hair loss is aggressive, then you may prescribe finasteride and minoxidil and stuff like that. So you're not against it. It just depends on the
Yes.
situation, if the patient is under your control and you feel comfortable with prescribing the medication,
Yeah,
right?
yes. If I give, for example, minoxidil spray, just I may add some PRP treatments, mesotherapy treatments, stem cell treatments. We have a lot of treatments related with the hair loss, and sometimes I combine all of them. Sometimes I prefer one of them the others. So it changes patient to patient, age, a lot of factors, you know.
Mm, okay, perfect. Yeah, I think that's a great explanation. I had another question. Well, this is my question because we all know what's been going on, in Turkey, and the battle that a lot of clinics are having, like yourself, clinics that value treating the patient and doing the work instead of just technicians. What have you felt like has been the biggest challenge for you navigating, this industry now, being in the position where you're at now? How do you think, what are the difficulties?
Now, I try not to forget that I am a doctor all of my life. Now, when I educated from the university, at the university, I promised myself that I will not lose my adjective that I'm a doctor. So, if you are a doctor and if you want to be a doctor, you need to consider the patient's benefits. Now, as a doctor, my priority is always my patients. It means that, yes, all of us, we want to earn money. This is the reality of the life.
Mhm.
But you have some priorities in your life. And my priority is my patients. Yes, if you want to earn money, you may earn much more than me. I accept it. You may do 10 patients per day, 20 patients per day. But I know that no doctor can do 10 patients per day.
Yeah.
So if you have chance, take 10 doctors and, for example, 20 nurses, then do 10 patients per day. I understand it. I accept it. But if I consider myself, if I talk about myself, I am only one doctor and I have a limits. I can do, for example, 15 or 20 transplantation per month, not more than this. I have maximum limits. So in that case, it is. I know it's difficult to protect your philosophy. It's too difficult in this world, but this is my choice, and I'm happy with my choice.
Yeah. And I think that I completely agree. And I think that obviously, we all need to make money, but there's a way about going and making money, right? And there's an ethical way. There's a way that you can do it while treating your patients like a patient and not just like a number, which I think is what I find so inspiring and encouraging from your practices. Really, that aftercare that I've heard your patients come on the forum and talk about how you check up on them, you send them emails and asking for progress and stuff like that. Very few doctors do that, and I think that just that little bit goes a long way, especially as a patient. So I think that's great. Another question I wanted to ask you is, um, somebody asked on the forum, what do you feel are the differences using the manual punch versus the motorized punch? Because I believe there's a difference in cost in your clinic, right? Um, and so some people are asking, is the manual better than the motorized, or which one's better? What are your thoughts on that?
No, no. As you know, every technique has advantages and disadvantages. So generally, I prefer to decide the technique with the patient and with the conditions related with the conditions of the patients. So I do both technique. This is the advantage for me. I can do manual and I can do micromotor. So if you ask me, if you want to compare the results, I know that If you do the both technique in a proper way, your both results will be very well. If you don't do one technique, although it is manual, if you use a bigger punch, if you want to work very quickly, if you are not respect to the tissue, if you don't have any respect to the tissue and graft, and if you don't spend time with the patient, your result cannot be good. Although we do everything well, as you know, we have chance we cannot get every time the best result. Sometimes some grafts may not be alive, sometimes complication may occur. So this is the part of the procedure we know, but I try to make the complication risks lower. Although I try to do my best, I have this risk, I know, and I try to make this risk lower. And manual and micromotor, if we think about the manual, yes, it has some advantages. You are just much more slower than micromotor. You may be more kind, but if we think that we can take with our because your arm is working there, you can take, for example, I can take maximum 1,500 grafts per day, approximately. So if the patient needs 4,000 grafts or 3,500 grafts, I know that I need 2 sessions and I need 2 days. It means that I will take 2 times risk for anesthesia. I will spend 2 times for him, 2 days for him, and he will pay double for the same result. So if when I consider the patient situation, I say that if the graft number is small, we may decide manual for you. If you want, yes, we can do 2 days by manual. It's a choice. But if you ask me, I prefer to do micromotor in 1 day. It means that you will have more advantages related with the time, related with the risk, related with the money, and so I need to compare the techniques. Also, sometimes I may prefer FUT. I may prefer just body hair transplantation. So it means that if, as a doctor, as an experienced doctor in hair transplantation, I have to decide the technique according to the patient. It changes every day. Age is a factor. The size of the recipient area is a factor. The capacity of donor is a factor. So we have a lot of experience that we cannot explain in 2 minutes. But I can tell all of the patients, all of the inquiries who wants to have hair transplantation. If you are touching contact to doctor directly before, during, and after the surgery, please, you will be in safe. It doesn't mean that I'm not alone. There are a lot of good guys in the world, a lot of good doctors in the world. If you are touching contact to them directly, it means that you are in safe and you are going to have good technique with you for you.
Yeah. You know, you brought up an actual question that I wanted to segue into, which was, you mentioned doing FUT, and to be honest with you, I think you're the only doctor that I've heard in Turkey that does FUT. Someone on the forum said, you know, when was the last time Dr. Basser did FUT? Because I see it listed on her site, but I just don't know if she's actually doing it.
No, it depends. Now, up to last 5 years, I was doing FUT too much. At least 2 or 3 times per month, because I generally do 15 hair transplantation per month. So 2 or 3 times per month FUT at the past. But last years, if the patients wants to have FUT, I accept. I cannot say no, but I generally prefer to discuss the technique with the patients, because if he wants FUT, I ask what is the reason, because you know, FUT may have long scar, not thick but long scar. The graft number may be limited, or it changes according to donor capacity. So if he is right patient for FUT, why not? This is really very good technique, I think, and I used it too much at the past. I don't want to stop to use it. If it is okay for the patients, why not? But but it generally I explain my patients that by FUT I can take maximum 2,000 grafts per day. So, and at least 1 year later, we can do the second one. At least we cannot do the second one 2 or 3 days later. And the elasticity of the donor is very important while I'm deciding the FUT. So if the elasticity is okay, if the graft number is okay, if he accept the risk, why not?
Yeah, and I think that, you know, FUT is a very viable option, and I think it's a better option for some people. You know, and for some people, FUE is a better option. So I think that it's so important to discuss with the surgeon, and for the surgeon to discuss, you know, the pros and cons, which is why I always felt that it's a good thing for surgeons to do both, because then, you know, there's no bias. They're just giving the patient, you know, real information and telling them which technique would best suit them. We had a question come in. Someone asked if hair transplant is safe.
General question for safe.
Yeah, he's just said, is a hair transplant safe? So I guess probably asking whether the hair transplant is, I guess, has low side effects. I'm going to assume, is that what he's asking?
Yes. No, the hair transplantation is really very serious. In Turkey, we say that small surgery. In European, you say in United States, you say that hair transplantation surgery. You gave how can I say? You think that it is more surgical treatment than Turkey. We say that a treatment. You say that surgical treatment. So if we do local anesthesia, and if we, for example, it takes at least 6 hours for patients. And generally, my hair transplantation takes more than 10 hours because I work very gentle and it takes all day. And so we use a lot of medicine. And yes, it has some risks. So why I say that this is a serious period? They have to think too much about the doctor, about the clinic before they decide it. Why? Because they have a risk to lose their donor capacity. Okay, the result, yes, we can repair the result. It's not big problem. For example, the patient may say that I don't have high density. No problem. We may add more density. But if you disturb the donor, you have no chance. If you have infection, it's too difficult to treat again. Or if you have necrosis, you have high risk and while you are just do reconstruction to it. So it means that yes, it has risks. So you have to be very careful while you are choosing the clinic, you are choosing the doctor. Why I say that? Be careful about the license. Be careful about the experience. Although we are experienced, we have risk to have some complications. We know it, and we just generally, I give very detailed information to my patients that you have to be careful. When they come here, they sign too much pages. It is written that a lot of complication inside. So it's serious treatment, I think, and we have to be very careful during and after the procedure.
Yeah, and I think that is the one thing that people just don't understand, is that when you're getting a hair transplant, it is a serious surgical procedure that should be done by the doctor. You know, it shouldn't just be done by technicians that you don't know what their experience is. Are they licensed? Do they have any medical background? You know, like you're putting your life in their hands pretty much, and your donor capacity, which if some of these clinics can do, you know, 6,000 grafts in one sitting and you get no growth from it, and now your donor looks worse than the top, really, what are your options? You don't have any more options. You know, you're limited. So you really have to think about preserving your donor and making sure that you don't waste any grafts, because, you know, you can replace money, but you can't replace the grafts.
Yes.
And that's one important thing.
The donor, now also you may have much more risk than your donor. because this is, as you said, this is a surgical treatment. So it means that the clinic has to be very clean. The doctor has to know the sterilization conditions and disinfection conditions, because if you have infection, it may be hepatitis B, hepatitis C, and HIV. If it is not sterilized, if the instruments are not disposable, you take high risk, much more worse risk than the losing the capacity of the donor. You may lose your health. So as a doctor, all of the doctor in this society, I know, they try to do their best. And I want to tell it to the patients who are choosing to black market, who wants to go to the cheap and the technicians clinics. They have to be careful, because although we have nurses, we educate them periodically. We educate ourselves periodically. We just improve ourselves every year. When I compare my results, my 10 years ago results are worse than today. This year is much more better than the last year. So if you improve yourself, it means that this will affect your results. So the patients has to be very careful while they are choosing the clinic. Really very careful. They may lose their health, not only their donor capacity.
Yeah, you bring up a good point. And I remember like years back, there was someone who came on the forum who was saying that someone who worked at the clinic said that they were not sterilizing the tools and they were just reusing them. So they weren't disposing of the tools. So, and a lot of people had folliculitis, they had these infections, like you said. And you have to think, is it worth it? Is it really worth it? Saving a little bit of money, is it really worth your health or worth, you know, your donor capacity or worth, I mean, just look at it in the long run. But people, you know, they don't seem to think of it that way. They want to, they act like it's like you're, you know, buying a car. Yeah, get the best deal on a car, but a car is not you, you know? You're investing in yourself, which is going to stay with you. So, I mean, I think you bring up some excellent points, and I think that you brought up a point that I kind of wanted to touch on, which was something that someone asked me, which was, what is your surgical protocol? What do you do, and what do you allow your technicians to do during the surgery?
No, I generally do the same strategy last 3 years. At the past, I sometimes change the parts before and after, but last 3 years it's same. Now, I think the hair transplantation has 4 parts. The first part is the preparation. The preparation means it's really very important for the patient. First, I will take some blood for tests. We will take some photographs, and he is going to fill some forms. Then he's going to ask all of his questions to me, and I will reply all of them. Then we are going to decide and agree on the technique. Then I do the front line, draw the front line. Then we are going to discuss about it. Then the assistants are going to shave his hair. Then we take another photographs. Then the preparation in my room is finished. Then he's going to go to upstairs in my clinic. There is a hair transplantation theater, and just he's going to be prepared there. What we do in that room, just we sterilize his hair, we do local anesthesia, and he really feels pain 4 or 5 minutes during the local anesthesia. I always tell to all of my patients, it's not, the hair transplantation means, yes, you will feel pain 4 or 5 minutes, but this is acceptable pain. Although I use needle-free anesthesia, you will feel the pain of the medicine. This is acceptable pain, but 4 or 5 minutes. Nobody may say that you don't feel any pain. I know. I test myself. I test the anesthesia
You're like, oh,
myself.
okay, that, yeah, it hurts. The initial injection hurts a little
Yes,
bit. Yeah.
related with the medicines, but very acceptable pain.
Yeah.
But after the local anesthesia, patients really don't have any pain during and after the procedure. They don't feel any pain after the anesthesia. Then the second part, I tell that this part is extraction, collecting, and counting. In my clinic, We do this part all together. One of the guy just counting, the other is collecting. I do extraction, and we change our positions periodically because I change his positions. Sometimes they count, sometimes I stop. So this part is done all together. Okay, the assistants help me. Then the third part, the incision part, only I will do it. Nobody will inside the room. Only I will do the incisions, and they will. I will do the angles, directions, density, aesthetic of the front line, everything related with the aesthetic and the medical treatment. I do in that part. Then the last part, putting the grafts. Yes, the team is doing it, but I am in the clinic with him all day. And no other patients in the clinic, only the patient and me. I just check the team periodically during that procedure. So this is the same, at least for 3 years. Sometimes I try to change the parts. For example, I may first do the incision part, then the extraction part. Sometimes I try this kind of manipulation, but at the end I decided to do this way. So I think when I compare my results, this is the last and best way for me.
Yeah, you found the right recipe. All right. So you do the extractions and the incisions. Do you
Yes.
have a technician that helps you with doing the extractions, or do you do it all by yourself?
I do it all by myself, but they help me while they are counting, collecting. At the past, we were doing it all together, but last 3 years, I do it only by myself. Last 3 years, I do it only by myself.
Perfect. Yeah, there was a little bit of confusion there. Someone said that, you know, your technician helped you, but you do it all by yourself, the extractions.
Yes, sometimes they may help me, but last 3 years, I changed totally. I do by myself.
Perfect.
At the past, they were help me.
Yeah, it's a very rare thing. I think you're one of the very few left in Turkey that are doing the work by yourself, that doesn't have, just the technicians doing
No,
all the extractions.
no, I saw that now at the beginning, for example, just also it is same with the manual. You were very tired while you were having some. You need to be fast, okay? So 3,500 grafts at the beginning. I need help from my assistants, but now last 3 years, I'm really fast enough and don't need any help.
Perfect. So that's perfect into the next question that someone asked me, which is, what's the experience of your team, of your nurses and your technicians? Like, what is their experience? Have they been with you for a while, or?
No, no, I don't know. In my clinic, all of the team are licensed and have insurance, insurance with the government. So I don't rent. For example, in Turkey, we say that rent a nurse, rent a technicians.
Yeah.
No, this is not my style. And I tell my patients that if you trust me, you need to trust my team. Because if I trust my team, I continue. If I don't trust anyone, I just stop to have my relationship.
Yeah.
This is my general strategy in my business. If I trust you, I work with you. If I see something wrong with you, I say that no, this is not my strategy, and I just, how can I say, I divorce. I just finish.
Yeah, that's a good way to put it. Yeah, so your technicians are your technicians.
Nurses.
You don't do any of the fly technicians from different places, which is it's very common now, even in Europe.
I don't
Europe, they're
share
hiring
anyone.
these technicians that are, just going around doing the procedure, and the surgeon is doing nothing.
I don't share my team with anyone else.
Perfect. Someone asked, what is the alternative area for donor hair besides the scalp?
No, as you know, generally I prefer to use beard as a donor. I prefer to use chest as a donor. But I always say that these are the last options, last chance for us. The most important thing is to use the main donor, the scalp. in a more how can I say, effective way.
Efficient, yeah,
Yes,
efficiently, yes.
yes, efficient way. If we use it effectively, we have no problem. So you may have a lot of density with the sessions, with the number of sessions. It's easy to have it. But if we how can I say, protect the donor, we have a lot of chance for the future. Also, if you have, for example, if the patients have some complications, we may use beard, we may use chest, we may use, I don't use, but some of my colleagues, they use all the extra body hair for the transplantation, but I don't have enough experience for the other part of the body.
Yeah, so beard, but beard is the best besides scalp.
Beard,
Beard is,
chest is not bad also. Chest is not
chest
bad.
is not bad. Yeah, and you know, you bring up a perfect point. I did an Instagram live with Dr. Wong of Hassan and Wong, I believe on Tuesday, and he said the same thing. He said that, you know, beard hair and chest hair, all of that is fine. But if you do a hair transplant and you don't waste any grafts and you do it efficiently, you don't really need to do, you know, get into the beard hair and all of that.
No,
It's all
sometimes,
about being efficient and not wasting those grafts.
yes, only generally I have some experience with the patient who is Norwood 7, Norwood 6, 7, 8. So
Yeah.
very limited donor capacity.
Yeah.
Sometimes they are very young. They want to get a lot of hair. I know. And in that case, I have some strategies just to combine both techniques. But I also say that this is not, how can I say, we cannot cover all of the recipient area, and if they accept, we can try to have more graphs for them, but
Mm.
sometimes we need to use it.
Yeah. Yeah, that's a good point. I mean, if sometimes if you're like a Norwood 7 and you have just a little band of hair, you may need to do, you know, your beard and everything.
Yes, last
Um,
chance, last options, but in that case, generally, I want to talk with the patients too much because expectations are very important in that way. If I am sure that he will be happy at the end of the procedure, I may start. Otherwise, I don't start, and I don't touch.
yeah, yeah. I think that's a great point. And so I wanted to ask you this question because I feel like you're in a perfect position, especially, you know, being in your clinic. What is the biggest problem that you're seeing right now with patients and, you know, needing repairs? Like, what type of cases are you seeing? Because as you mentioned, you know, there's a lot of people going to these black market clinics where I've seen something particularly disturbing where they offer unlimited grafts, you know, for one set price, and then at the end they give them a certificate of guarantee, of guaranteed growth. Like they give them a guarantee, which we all know there's no such thing as a guarantee in hair transplantation. That's just the ethical doctor and person would say there's no guarantee. So what has been your battle, or what type of things have you seen with these patients going to your clinic?
No, all of the treatments in medicine, just our teachers, our professors teach us that we can never give a guarantee to any of the treatments. For example, if you have influenza, we cannot say that take this antibiotic and take this antivirus treatment and you will be safe. And although you will have pain, we cannot say that take this painkiller and it's finished. You will be in safe 2 hours later. No, this is your body. These are treatments. These all of them have effects and have side effects and have complication risks. Although we try to do our best. So, what I see generally, I want my patients to be very careful about their donor. If the donor had a lot of disturb or a lot of trauma, it's really
Mm-hmm.
difficult for us to do reconstruction.
Mm-hmm.
The second one is generally the angles of the front line.
Mm-hmm.
Sometimes the low density, but I think the low density is the smallest problem in the hair transplantation because you may add more density. Okay, and
Yeah.
what else? Sometimes I saw some necrosis. Just they sent me some photographs, and if we can have chance just to treat it at the beginning, yes, we can handle it. But
Hmm.
if they lose time, I think they don't have a lot of chance. So they need to do big, they need to have big reconstructions. So they have to be careful. We have to be careful. And what I want from all of the patients, please, for all of the complication, yes, you may have, we know it. We know while we are doing the hair transplantation, what we take as a risk. Please touch in contact to your doctor. If you have any problem, we can solve it.
Hmm. Yeah.
Okay, we can solve it because we know the way.
Yeah.
If you are going to touch in contact to your doctor, you can solve your problem. But if you want to, how can I say, just produce the problem, you may
Hmm.
produce the problem.
Yeah. Yeah. No, that totally makes sense. And I think, you know, what I've seen, and even recently, somebody came on the forum and was showing just like a lot of necrosis, like it's almost jelly patch. It looked like jelly under the skin, and come to find out they went to a dentist. So a dentist did their hair transplant. Can you believe that? So it's these things where, you know, these live sessions that I'm going to keep on the Instagram are so important because people can refer to it and they get education, you know, for free. And really, the reason why people go to like a dentist or one of these black market clinics is because they think everything is going to be okay. I'm going to get my hair transplant. It's cheap. You know, I can just live my life doing nothing, but they don't see the reality, which is you can get necrosis. You can get, you know, permanent, uh, have your donor capacity permanently ruined. You can get grafts misangled where it looks like, you know, like cat whiskers on the top of your head. I mean, there's a lot of complications that people don't really take into consideration. So I think this is awesome. It's really enlightening, and I think that when people are researching your clinic, they should be seeing that, for one, you're doing the procedure, right? You're focusing on them as a patient, which I think is super, super important. You're not just, like you said, 10 patients, because one doctor can't look over 10 patients. It's just not possible. You know, it's impossible. So you're focusing on them as a patient. You're consistently following up with them after the surgery, right? So sending them emails and asking them to give you progress, which all of these things, the aftercare and all of that, is so important when you're researching a clinic and choosing which doctor you want to have. So I think that's fantastic that you do that. Um, and I wanted to know just a little bit more about your philosophy in terms of, somebody asked, what 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 makes a good hair transplant? Um, so is it the number of grafts? Is it the number of grafts per square centimeter? Is it, you know, is it that the height hairline? Is it the thickness of their hair? Like what makes a good hair transplant?
No, I think it's related with the experience. No, really. Now I'm getting older and older, and I'm really learning every day a new information about the procedure. Every day I get new feedback for myself. Now, uh, first of all, if you want to get good results, you have to observe the patient very well before the procedure. You need to check the donor capacity, and you need to know your limits and patient limits. Okay, and how many sessions he needs. Does he have chance to lose his native hair in the future? Because sometimes you transfer some hairs and they lose their native hair, and you need to add more. Okay, and sometimes the thickness of the hair. So you need to do a strategy for the patient, and you need to do this strategy And you need to consider the age of the patient, the quality of the hair, the size of the recipient area, and the expectations of the patients. So if you are agree with the front line, if you do good density incisions, if you know the angles, if you know the directions, okay, you have high chance to be successful. But although we do everything in a proper way, as you know, sometimes we cannot be successful. So, but what we can do, we can handle it. If we protected the donor, we can add more grafts. We can, okay, if they lose their native hair, we can add more, no problem. But if you just do, for example, multiple grafts to the front line,
Yeah.
okay, if you don't know the angles, if you don't know the directions, if you don't care about the sterilization,
Yeah.
disinfection, so it means that generally, I give one example in all of the congress. For example, if you are a doctor and if you know the sterilization and disinfection, and if you take everything under control, although you do your best, you have a small risk for the complication as an infection, okay? But if you are not care about it, you have high risk for infection. It means that you can take some risk under control, but you have to be careful. If you are not aware of it, it means that it is not a complication. It means that it is malpractice. Okay? But if you take it under control, if you try to do your best, it means that it is complication. So there are some borders between the how can I say, malpractice, complications. Although you do your best, you have small risk. But if you don't do your best, you have high risk for that.
Yeah. I think that's important. So I wanted to ask you, because you talk about it a lot, and I think it's a good thing. Very, very few doctors talk about expectations, right? Because a patient may come to you and they may be young and they're losing their hair and they want, they expect to have one hair transplant and have perfect density, have all the coverage, and that's it. So how do you navigate these patients, or how do you educate them to explain to them the process, and explain to them the possible complications, or the issues that can arise?
Now, I have a really wonderful team. I think this is the secret. Now, my team, my interpreters are really very honest, really very honest, and they say that they trust me and I trust them. And they really just to give, they just give very honest information to the patient. And my team always says the worst case and the best case of the procedure every time. And before they come to Turkey, just last 3 years, I changed all of my strategy. I do online consultation with all of my patients before they come here. Why? Because I want to learn their expectations, and I only want them to be touching contact with me at least 1 year after the procedure, because the experience, the time showed me that if they touch in contact to me 1 year, if there is any problem, I have a high chance to solve it. But if they don't touch in contact to me, what can I do? So last 3 years, I asked them. They promised me. If they promise, I take the patients. If they don't promise, I will not.
Wow.
So this is the reason. So if any problem, if, for example, if the density is not good, okay, come here, we may add, no problem.
Wow.
But this is important. But if they don't touch in contact 2 years later, 4 years later, okay, Dr. Bichar, now I'm not happy. Okay, where are you up to now? Why you are not? I think I'm right. If you are touching contact to me, I can solve it. I have a lot of ways. I have a lot of treatments. If any problem, we are educated for it. Okay,
Yeah.
so if they are, so why I want from all of the patients, not only from my patients, please touch in contact to your doctor directly, because
Yeah.
doctor knows how to solve the problems.
Yeah. And you know, I say this a lot because obviously people come on the forum and they complain. And then recently someone came and they were at 6 months, right? They had their hair transplant 6 months ago, and they were complaining, or they were saying, you know, I'm worried that this has failed and it's not good. And I said, well, you know, have you contacted the doctor? Are they aware? Um, and so I actually went and contacted the doctor, and he came on the forum and he put a response, and that just that communication completely put the patient's mind at ease. Because, you know, as a patient, sometimes you may think, you know, you may start to worry and be like, well, this guy's hair transplant at 6 months looks way better than mine. Maybe mine's a failure. But you have to realize you're an individual. Everybody has growth rates at different times. Like, you may grow, may take you full 12 months to look good. Other people, you know, they may grow in 6 months. They look like, you know, their hair's perfect. But we're all individuals. Nobody's growing at the same rate. So, you know, just keep in contact with your surgeon, communicate with them, let them know what you're feeling, what you're thinking, which I think is so crucial. And I think it's amazing that you're telling your patients, look, keep in contact with me for at least a year so I know what's going on and I can monitor your progress. Very, very few doctors do this, which I feel, you know, is a huge disservice to their patients, because, you know, uh, patients can let their mind get the better of them. And, you know, hair loss is very emotional. When you start to lose your hair, it's an emotional thing, and you want that fix, you want that solution, you want it to come quickly. And unfortunately, hair transplants take time to grow. So while you're waiting, your brain can be thinking a million things. So, you know, keeping in contact with your doctor, having them tell you, you know, or even show you cases. I don't know if you do this, but if, you know, one of your patients could come and say, you know, I don't have any growth, it's been 5 months. And maybe you have another patient that you can refer them to and say, look, this was another patient at 5 months. He was like you. And then look how his hair looked at 18 months. You know, you just have to wait it out. And I actually made a video on YouTube talking about this slow growth, which I feel like isn't discussed enough. Um, so, you know, patients can feel somewhat relieved to know that, hey, I just got to be patient, trust in the process, trust that I chose the right doctor, and, you know, the results will come. But
And also in hair transplantation, we don't know every parameter that affects the results. No, we try to control what we know,
yeah.
but we don't know all of the parameters. Really, sometimes we cannot control everything because
Hmm.
we don't know. Okay,
Yeah.
sometimes it is related with the blood circulation. Sometimes it's related with the patients. I have some experience at the past. If they use drugs, they affect the blood circulation, and if the patient doesn't tell it to you, you have high risk for the complication.
Hmm.
So sometimes generally I say my patients that please be honest. Are you using drugs? Do you smoke? Or are you using any medicine? Or do you have any health problem? uh, a lot of factors affect the results. If they do sports, this is good for us. If they use, for example, how can I say, some vitamins, yes, we prefer it. But sometimes they forget to give detailed information to us. They think that this information is not important for them.
Hmm.
It doesn't affect the result. But I need to learn a lot of parameters related with the patient. So we try to take under control what we know. But it doesn't mean that although I transplanted 3,800 to you and to your friend, the result may be different. I'm the
Hmm.
same doctor, same technique, all day with one patient, with the same experience, with the same graft quality, with the same circulation, but result may be different. So it means that we cannot give any guarantee to the patient. It's impossible because it doesn't like cooking a cake.
Yeah.
If you want to cook a cake, yes, you know the formula, you know it,
Yes.
okay? But this is a live tissue. This is a live graft. So
Yeah. It's and you put it so well there. It's people don't realize, but like a hair follicle is an organ. You're transplanting thousands of live organs into your scalp. So yeah, everybody's different. You cannot give any guarantees, and a lot of these clinics that give these certificates, they come on the forum and they post the picture of the certificate, and then next to it they say, I've been trying to contact my consultant and they blocked me on WhatsApp. So that the guarantee is pretty much, it's just a piece of paper. So don't pay attention to these guarantees that are just practically pieces of paper. Uh, a good ethical surgeon will tell you that they can't guarantee it, but what they can do is guarantee that they're going to be doing the work and their team is going to be assisting them. And so you're getting consistency, which I think is what patients should look for, consistency. If you have a team, if you go to a team of technicians, maybe at this day there's this group of technicians, and then another day it's a different group, and then maybe some of them leave and get a different job, and new technicians come in. So you're not getting the same team, you're not getting the same consistency. So it's really sort of like hit or miss. It's like gambling. Maybe you get a good result, maybe you don't. So I think that's the perfect way to put it at
no,
these clinics.
no, the point is important. Now, I understand the patients. Now, this is a huge market, unfortunately.
Yeah.
And they cannot know which is true, which is false, which is fake, which is real. Really too difficult. Some of my patients, I just talk too much with them. I love to talk to my patients. Really, I really very happy while I'm talking to them. They give a lot of good data to me. It's too difficult for them to choose the real one, because when you check the reviews, Google, when you check the, yes, you are in the society, and all of the experienced guys in the society, we know which is true, which is false, which is fake.
Yeah.
We understand, we are clever enough because we are in the society. Okay?
Yeah.
But out of the society, you don't know anything about it. And you need to do very detailed research. Why? Because sometimes, some competitors do the fake results. I had at the past, I didn't have this result was not belong to me. Just they set it in the forum and they said, this is Dr. Beecher's, and after that they learned that this is not my result, this is somebody else's result. So if you learn, you can manipulate it. But if you don't know, you can do nothing. So this is really big market, and patients has to do very detailed research, and what I try to do for the patients, I tell that if they come to me, yes, I know that I will try to do my best. But if they prefer my colleagues, I'm really very happy for them. Why? Because all of the doctors in the society, I know they are doing really very well job.
Yeah.
Really very well job. If they are touching contact to doctor, I'm really very happy for them. I know that they are in safe. But if they are not touching contact to doctor, the agencies,
Wow.
a lot of black market we have, unlicensed people, unlicensed commissions. So please be careful touching contact to doctor, Because if you have problem, the doctor will solve it,
Yeah.
not the others.
So what do you think, and because you bring up a lot of good points and a lot of people don't even know what you're even talking about when you say agencies. Like you said, we're in the industry, so we know about these agencies, but people, they're not aware. So basically what an agency is they're like middlemen. They're pretty much salesmen. What they do is they go and attract patients, and they send them to this clinic, which usually the clinics are these black market clinics, and they take a commission. So I know this guy, he's a consultant for HTC, Dr. Morris in Cyprus, and he had his donor area completely destroyed. And so he told me about this agency. And so what the agency actually does is they charged a commission higher than the actual surgery itself. And he showed me pictures of people that come and send him emails and that their donor area is completely destroyed. He actually almost died while having surgery. They gave him so much anesthesia that he overdosed and he had to be rushed to the hospital. So I want people to understand.
I don't know the case. I don't want to target one agency or
Oh
two
yeah, no, no.
agencies. I don't want to talk for one guy or two guys.
Yeah.
I just want to tell that I don't want me misunderstand. I only want to say that yes, I know that there are really honest agencies in the world, really very honest. They do their job well. They work ethically. They don't. How can I say? They are respect. They have respect to the doctors, to the patients, and not fake stories. I know this kind of good agencies we have, but generally, I want to say that if you are touching contact to doctor directly, why it is important? Because I don't want to sell anything to any patient. I'm not a marketing manager.
Yeah.
Okay.
Yeah.
I don't need to earn money from the patient because I have enough patients. Okay. Because
Yeah.
doctors, generally, the doctor's priority is the patient, not the money. All of the doctors, not only for me, their priority, our priority is our patients. But if your priority is something else, money, numbers, number of the patients, it means that the patients has to be careful. So all of the doctors in this society are working for this now. Why? Because we see the bad results, not the low density, not the, for example, we can recorrect, no problem.
Yeah.
But if you lose your donor, if you have hepatitis B, if you have, for example, local anesthesia complications, if you have necrosis, if you are in depression related with the results or related with your expectations, so at the end we are going to help you.
Yeah. Yeah, just to clarify, yeah, there are definitely, I'm sure, agencies that do good work and everything that route people to good doctors. But I think it's important to focus when you're going to a clinic. You want to make sure that they're patient-centered, right? That their focus is you as a patient and not their focus is on getting as many people as they can to have surgery. And I think a big red flag that you as a patient or anybody watching this is if you're going to consult with a consultant and you're not seeing the doctor and they say, you know what, if you get surgery right now, I'm going to give you half off, 50% off. Get surgery right now, today, this moment, we'll give you 50% off. That should be a red flag. And this has happened. I've talked to people where this has literally happened. They go to a consultation. They don't see a doctor. They're probably one of 20 in the waiting room, and they're telling them, if you have surgery right now, we give you 50% off, like you're buying a car. These are red flags. Like you said, you want a doctor who sees you as a patient, because as you said, if the doctor's work is good, the money will come. Their results will show it. Patients will want to go to them, so they don't have to worry about that. You know, and I have a saying, even on the forum, is on the forum, me personally, or even on this channel, on YouTube, on Instagram, we don't sell hair transplants. We educate. We educate first, and then when educated patients understand the reality of getting a hair transplant, the risks, the pros, the cons, everything, then we route them to good quality surgeons that we feel would do a good job on them. But we don't sell hair transplants. So somebody, you know, will come to the forum and say, I want to get a hair transplant, but I'm not convinced. Well, I'm not going to convince you. You know, if you either want to, you know, I will give you the pros and cons, give you the information, and it's up to you to make the decision. You know, I'm not here to convince you. And I think, as you said it perfectly, you know, doctors are not there to convince patients either. They're there to treat them, give them the truth, and then let the patients decide, which I think is awesome. I really enjoyed this conversation, Dr. Becerra. I feel like I got a good understanding of your philosophy,
Thank you.
you as a person, which I think is fantastic. I'm so confident in the work that you do now, especially there's been a lot of interest in, you know, let's face it, money matters, and people want a hair transplant that's affordable, and they want affordable options, but you know, you don't have to sacrifice quality with affordability, which is what I always want to preach. There's always going to be a doctor that's cheaper, but are you getting quality? You can get both. You can get an affordable, you know, doctor, and you can get a doctor that does the work, that is you know, qualified, has a good team. You just have to know what to look for, and you have to really think about, you know, is the doctor doing the work? You know, which I think is super important. So thank you again, Dr. Becerra, for joining me. I will
Thank you.
keep this saved. So if you ever want to share this with your patients, feel free to. So just in case, if anybody watching this wants to get in contact with you, or send you a question, where can they email you, or you know, contact you?
Uh, do you ask my email?
Yeah, if anybody's watching this and they want to,
Yes.
you know, reach out to you and
Info,
ask you a question.
info at özlembiçer is info at özlembiçer.com. My website is www özlembiçer.com. They may find they may just find our website in the Google, and also the hair restoration social network is a good area for me. They can see my results there, and I also want to thank to you. Really, it's really very important for me. Just you take me in your recommendation list, and it's an honor for me. Really, I want to thank to you for this. I hope this Instagram will help the patients. We may help them. If they have any questions, we are here to answer them.
Awesome. Thank you so much, Dr. Becerra. I hope you have a great night. Thank you guys for joining us. All right. Bye-bye.
Bye.